I was enjoying a podcast featuring Trevor Noah and Holly Berry, and they touched on a topic that most people are too afraid to talk about: vaginal health. Now, if you haven't seen it yet, I'll link it in the video notes. But when I heard them discussing it, I knew I had to do my part and bring this conversation to you. Because for peri and postmenopausal women, this is one of the most important videos I'll ever make. Women deserve to have a healthy, thriving sex life. They deserve to feel comfortable in their own bodies. But too many suffer in silence, and that's just not okay. So today, as a board-certified family doctor, I want to help you understand why vaginal health matters, what happens when things go wrong, and most importantly, how to heal so you can live a full and confident life. And do me a favor, let's continue this conversation in the video comments. Then we should be just as comfortable talking about women's sexual health. So let's get into it. A lot of women don't realize how much vaginal health impacts their whole life. It's not just about discomfort or dryness, it's about quality of life. Here's what happens when vaginal health isn't in check. Number one, it affects your relationships. Intimacy can feel painful or impossible, which can create distance, frustration, and even shame between partners. Number two, it impacts self-esteem. When your body doesn't feel right, it can make you feel less confident, less feminine, and even less desirable. Number three, it can cause real emotional distress. Many women feel like they've lost a part of themselves, especially after menopause, childbirth, or certain medical treatments. Number four, it can lead to chronic infections. Recurring yeast infections, bacterial vaginosis, and UTIs can be a sign of imbalanced vaginal flora and dryness, which creates an environment for bad bacteria to thrive. Number five, it affects bladder function. Many women don't realize that poor vaginal health can contribute to urinary incontinence. When vaginal tissues weaken, they don't support the bladder and urethra as well, leading to leaks, urgency, and irritation. But I'm here to tell you, it doesn't have to be that way. Let's be real for a second. If we can have primetime TV commercials about erectile dysfunction, then why is women's sexual health still treated as a shameful secret? We don't blink an eye when we hear about Viagra, Cialis, Levitra, or testosterone replacement therapy. But when women need solutions for vaginal dryness, pain, or low libido, society acts like it's too much information. Enough of that. Vaginal health is just as important as other parts of your health. And today, I'm going to give you real solutions to restore your body and your confidence. And hormone replacement therapy, also known as HRT, is one of them. Now, I know some of you have heard scary things about HRT, but hear me out. The Women's Health Initiative study published in 2002 caused panic by suggesting that HRT increases the risk of breast cancer, heart disease, and stroke. But here's the problem. The study included women who were much older and had pre-existing health conditions, making the results not applicable to most women. It didn't distinguish between different types of HRT like bioidenticals or synthetic. More recent research has debunked these fears, showing that for many women, HRT is safe and beneficial, particularly when started before age 60 or within 10 years of menopause. So if you feared HRT in the past, it may be time to ask your doctor to reconsider it based on your risk factors. Now, other medicines that can be helpful include vaginal estrogen creams. They restore moisture, elasticity, and pH balance in the vaginal tissue. DHEA vaginal suppositories support natural lubrication and libido. Osphena, a pill that works like estrogen in vaginal tissues but is actually a selective estrogen receptor modulator, meaning it helps with painful sex due to vaginal atrophy without stimulating breast or uterine tissue like traditional estrogen does. If you prefer a natural approach, there are real solutions that help increase vaginal circulation, lubrication, and overall health. Let's start with number one, supplements that support vaginal health. L-arginine. It increases nitric oxide production, improving blood flow to vaginal tissues. Maca root, known to balance hormones and increase libido. Omega-3 fatty acids, supports healthy cell membranes in vaginal tissues. Collagen and hyaluronic acid, helps maintain hydration and elasticity. Number two, VFit. Hear me out, ladies, this could be a game changer. Imagine having a way to work out that part of your body like going to the gym, similar to how men may use a pump to do the same thing. VFit is an at-home device that uses gentle red light therapy to restore vaginal tone, moisture, and circulation. It works in 3 ways. Red light therapy, which stimulates collagen production, improving elasticity. Gentle heat increases blood flow and comfort. And vibration technology, which helps stimulate pelvic floor muscles to prevent atrophy. I'll share a link in the video notes if you want to check this out. I know for many of you, it looks a little too much like that other type of device, but trust me, it's FDA approved and it actually works. And in my opinion, it's totally worth the investment. Number 3, natural lubricants and moisturizers. Let's start with olive oil, which is moisturizing, natural, and safe for vaginal tissues. Coconut oil is antimicrobial and long-lasting for intimacy. Aloe vera gel, soothing and helps maintain vaginal pH. Vitamin E oil helps repair dry and irritated tissue. And shout out to Holly Berry and her company, Respin, for creating Let's Spin, an intimacy gel made up of some of the components I've mentioned, like hyaluronic acid and aloe vera, as well as citric acid and gluconolactone, all of which are considered natural and safe ingredients. Number 4, exercises that support vaginal health. Pelvic floor exercises, also known as Kegels, strengthens muscles that support vaginal tone. Yoga and Pilates, strength training, helps maintain hormone balance and overall muscle tone, which helps maintain hormone balance and overall tone. Now ladies, let's be real. Too many women are suffering in silence. So if this video helped you and you learned something new, do me a favor and share it with friends, your sisters, your mom, your coworkers, whoever needs to hear it. Because if men are able to talk openly about sexual health, so should you. And if you're struggling with vaginal dryness, pain, or discomfort, just know there is help. You don't have to accept suffering as your new normal. So let's start talking. Let's break the stigma, and you can do that by having a conversation in the video comments. Let me know if you have any questions, because this is a safe space to have this conversation. And don't forget, hit that like button, subscribe, and turn on notifications so you'll never miss another video. Because every woman deserves to live her life fully, vibrantly, and without shame. Thank you for coming to this video, and I'll see you in the next one.